I was born on a different planet. And I know the students are saying, I knew it. We were all born on a different planet, right? One that was cooler, cleaner, and less crowded. It's the crowding I want to talk about today, to talk about why I think we're at the highest risk ever in human history for a civilization-ending infectious disease outbreak. Most infectious diseases are communicable diseases. That means they're spread from person to person. That means that when there are more people, there's more risk of spread. Tuberculosis was a known disease, but not a common disease, until people gathered together in 19th century urban Europe and the United States. Not only are people crowding together, but they're crowding together in cities. Let's use this room as an example. There are probably 120 people in here. Let's use that as the population of the world in 1950. Population now is 8 times that. If we had more than 1,000 people in this room, think how easy it would be to transmit an infectious disease from person to person. In addition, more and more people are living in cities. More than 50% of the world's population will live in cities in the year 2050, most of those in developing parts of the world. And that puts an incredible stress on infrastructure, sanitary, water, food delivery. But we can see even here in the developed world that unless we have constant maintenance and scrutiny of water and sanitary systems, as we saw in Flint in the last few weeks, we're at risk for crossing that line. I call that the thin brown line. In addition to crowding, there's a lot more mixing. People move and travel much farther these days than they once did. This graph shows the average distance that people traveled by various manners in the last 200 years. Down in the lower left corner, the average person in 1800, a farmer, walked a kilometer to his field and back each day. Now people travel hundreds and thousands of kilometers in a day and come in contact, depending on how you define contact, with hundreds, thousands, and even tens of thousands of people each day. In addition to the crowding, I want to talk a little bit about antibiotic resistance. We're surprised when bacteria are resistant to antibiotics, but we shouldn't be. Bacteria were resistant to antibiotics 10 million years ago. Why should that be? Think about where we get our antibiotics from. They're produced by fungi, penicillin and fungi. Why would a fungus produce an antibiotic? Well, back when bacteria and fungi were duking it out 10 million years ago for the ecologic niche, bacteria came up with antibiotics. We've exploited those for ourselves, but they were meant to be antibacterial substances. Well, bacteria had their own tricks, and those tricks remain on those bacterial genomes today. And they can pull those tricks out of the bag whenever they are exposed to the antibiotics that we give people. So should we just go home and pull up the sheets? Well, I've got a few suggestions, a few practical and one more philosophical, about what we can do to keep this civilization-ending infectious disease outbreak at bay. The first I would say is to wash our hands. That seems like such a simple thing. But washing your hands is the most effective way to interrupt that chain of transmission from thousands of people that you come in contact to each day. The second I would say would be to support that sanitary and water infrastructure. There are 2.9 billion people in the world today that lack a toilet. If we built 26,000 toilets a day, 7 days a week for the next 25 years, we'd meet that need. Sounds like an employment opportunity to me. Next, I'd say, and I'd be remiss if I were giving a talk about public health and didn't advocate for more funding in public health, but it's public health that's going to be the barrier between this disease-ending outbreak and one that's just catastrophic, or the civilization-ending outbreak. We need to spend more money on public health surveillance for infectious diseases, more money on education, and of course, supporting those toilets. So, the last thing I want to say is that we need less hubris. Hubris means pride, overconfidence, and we certainly see lots of hubris in the world today. President Obama got some pushback because in the State of the Union, he basically claimed that the United States had conquered Ebola in West Africa. So we see hubris in lots of ways on a daily basis. We see hubris and we see fear, which is the lack of confidence. And I would urge the people in this audience, the students in particular, to think about how to find that sweet spot in between the two, not being too confident, but having the right amount of confidence. On my home planet, there's a lot of hubris, and I would bet that there is on yours too. And it's not easy to find that spot, but I think it's going to be critical in terms of being able to identify these problems early, respond to them in a coordinated way, and to actually keep these things under control when they first appear. Thank you.